Clinical Pearls brought to you by Medicom Oncology.
My name is David Sallman. So I'd like to give a little bit of background into CAR therapy in acute myeloid leukemia patients. So whereas in B-cell malignancies, particularly diffuse large B-cell lymphoma, ALL, and others, CD19 has really emerged as a really optimal target in that you can sort of go for disease eradication without a lot of toxicity sort of on the normal bone marrow. In acute myeloid leukemia, the challenge is that you have the potential with CAR therapy of hurting normal stem cells. So basically, if you eradicate normal stem cells, these patients may no longer have hematopoiesis and be stuck with even a more major problem than what they began with. And because of that, pretty much current CAR strategies often require either a backup allogeneic stem cell transplant or some sort of novel mechanism in which to turn off the CAR, but of course that's complicated and sort of what's the optimal way to do that. So because of this, in collaboration with Sallman, the THINK trial was brought about, which takes the activating receptor on NK cells called NKG2D, which targets a number of ligands that really are preferentially expressed on transformed or cancerous cells and not on normal cells. And in particularly, at least in evaluation of AML patient samples, really nearly all patients will express at least one of these ligands on their blast. So because of this, that was sort of the thought process in this trial. A little bit on the THINK trial itself, basically patients have apheresis, of their own T cells, and then subsequently will receive 3 infusions of the CAR product spaced 2 weeks apart. And so to exemplify this excellent case, an exciting case of a responding patient, we had a 52-year-old gentleman who was refractory to initial induction. He was able to achieve a first remission after salvage chemotherapy, but unfortunately only had around a 7-month remission. He was being worked up for transplant, but there was some delay secondary to pulmonary issues at that time. And so eventually he developed worsening cytopenias, and a bone marrow did confirm evidence of relapse disease with around 7% blast and severe constitutional symptoms as well as severe cytopenias. And he enrolled, on our trial. The patient tolerated the 3 infusions very well. And after the second infusion, did have complete clearance of their blast and start of hematopoietic recovery. He subsequently had his 3rd infusion, and then at day 57, this was confirmed with blast clearance and continued hematologic recovery. This continued up till about 3 months after the initial infusion, at which point he was actually bridged to allogeneic transplant, and at that time was in near complete remission with platelets in the 90s and neutrophils in the 900, and again, resolution of all of his symptoms before. And the patient now is currently 6 months out from transplant in remission and doing well. And so a couple other things to exemplify is in this setting, in this trial, patients do not get preconditioning chemotherapy, so the CAR does not last long, but still in this setting without the use of preconditioning therapy, and this patient was actually on the first dose level of the trial, again, we were able to achieve a good remission and was able to successfully bridge him to transplant, which is still the standard of care in this patient group when we're looking for curative intent for these patients. So I think, in conclusion, the excitement at least, shows some evidence that, targeting NKG2D ligands can be of clinical utility, as well as, successful CAR treatment of an AML patient, again, without the need of preconditioning chemo, at least in this trial, which is the first of its kind. And hopefully, this will just continue excitement and further growth of CAR development in AML. We are continuing to recruit on this trial. It's still in the dose escalation phase of the trial, and patients or providers could always look up information on clinicaltrials.org, or they're welcome to sort of directly reach out to us at Moffitt Cancer Center. It's for consideration, as there will be potentially other trials with this technology, as well as other CAR options in the future as well.
Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingaml.com for more practice resources.